The Gartland's classification is used for extension type of fracture about supracondylar fracture of the humerus, and we have the type 1, 2 and 3 type of Gartland's classification in the supracondylar humerus fracture. So in type 1 it is undisplaced fracture. It is undisplaced fracture, and there is only fracture line is there. It is not displaced. In type 2 it is further divided into type 2a and 2b. Here it is an incomplete fracture. Here we can see that in type 2a there is the posterior cortex is intact. In both type 2a 2b there is both intact posterior cortex. So type 2 has the one, there is break in the continuity in the anterior part, so there is break in the anterior cortex. And in type 2a there is no rotation or translation. There is but in type 2b there is some degree of rotational displacement or translation. And in type 3 the type 3 is to complete displacement. There is completely displaced, and with the displacement of distal fragment. So type 3a also, it is, although it is not shown here, type 3 is also further divided into 3a and 3b. In 3a there is posteromedial dislocation, whereas into 3b there is posterolateral displacement. So thank you. That was all about Gartland system of classification in supracondylar fracture of humerus.